Hello, my name is Michael and today I'm going to be talking about the reversal of the medical procedure, pulmonary artery catheterization, known as POC. The pulmonary artery catheterization was invented by Dr. William Gons and Dr. Jeremy Swan in 1970. And the pulmonary artery catheter is a balloon tip catheter that's inserted into one of the two pulmonary arteries and is used to diagnose many cardiovascular related health problems, including pulmonary edema, which is a fluid buildup in the lungs, heart failure, congenital heart disease, high blood pressure, and fat embolisms, also known as blood clots. This medical tool became very popular and was used in many critical care units throughout the country. Pulmonary artery catheterization works by inserting a catheter into the right arm, which then travels to the superior or inferior vena cava through the right atrium of the heart down into the right ventricle of the heart, up the pulmonary valve and into one of the two pulmonary arteries. And the pulmonary arteries are two major arteries that push the oxygenated blood coming from away from the heart, coming from the heart away to the lungs. The balloon is then inflated while inside of the pulmonary artery, and this procedure helps determine pressure in the right atrium and ventricle of a patient's heart, as well as the arteries of the lungs, and is also used to help determine the patient's cardiac output, also known as their blood oxygen flow. POC can also obtain venous and arterial blood samples that can be analyzed. Some benefits of the pulmonary artery catheter is that it can be inserted rapidly and safely into a patient's heart and can provide information about the patient's cardiodynamic status that enables the physician to institute appropriate treatment. A November 2020 study by the Canadian Anesthesiologist Society found that that the use of POC in the hospitals led to a reduction in hospital mortality rate. And utilizing POC for tailored therapy to optimize cardiovascular health led to a better prognosis, also known as an outcome. Due to its high popularity, POC was frequently overused in critical care units, resulting in many complications, including mortality. There were several key trials and studies that were published stating that POC was not an effective therapeutic tool and should only be used as a tool for diagnosis. As a result of these studies, the use of the tool decreased significantly over time. One such trial that was published that led to the decline in usage of POC devices was the ESCAPE trial. The ESCAPE trial was a clinical trial conducted by the Evaluation Study of Congestive Heart Failure and Pulmonary Artery Catheterization Effectiveness, and it found that the use of pulmonary artery catheterization did not significantly affect the number of days alive or the number of days hospitalized. However, the trial also found that it did not increase mortality or length of a hospital stay. To conclude, there was no need for the routine use of PAC for treatment of patients. Some international studies still recommend the use of POC for patients suffering from cardiogenic shock and other serious heart conditions. Approximately 1 million POC devices are currently being used in the United States. However, it's only being used for diagnosing cardiovascular problems. Instead of it, however, it's previously used for both diagnosis and treatment. And it's also used for assessing a patient's current hemodynamic status, which is the study of blood flow. Although it's as shown to have not been effective as treatment, um, PAC has had a very big impact on the world as it paved the way for the medical world's current knowledge of hemodynamics. Thank you for reviewing my presentation. Here are my references and sources.